Okay, so Megan O'Lynn is kind enough to join us today. She's been using the NecksLevel device at her clinic, and I'll let her tell you guys more about the clinic specifics. But they've had it now for probably close to half a year, I would guess. My classmate Jake Moyer got into Moti, and they've been using it ever since. So Megan, would you mind telling us a little bit about your background and how you got into physical therapy, what schools you went to, et cetera?
Yeah. So I went to Mount St. Mary's. I graduated the class of 2012. What brought me into the PT realm was I was an athlete. I played water polo and played for the University of Hawaii, and always seeing injuries happen and my teammates getting injured. I knew I didn't want to triage the injury like with athletic training and be on the field, and wanted to focus more on rehab, getting back to play, but also more movement science and mechanics to kind of optimize performance and so that you don't get injured. And that's where physical therapy really kind of was the place for me that really brought me in there.
And then can you tell us a little bit about where you work, the type of clinic it is, and then your locations?
Yeah, so I'm the clinic director of Moti Physiotherapy, Los Feliz, and we are an outpatient sports orthopedic facility in Los Feliz. We see and treat
In what state?
California. We treat all orthopedic injuries, head to toe. We see a lot of post-operative cases and just kind of overuse injuries from just being a desk worker or any type of sport.
And then how long has Moti been around? Because I remember my clinical instructor, Brian McNeil, he was saying that Nick Cutry was going to open up a clinic when I was in PT school. So I don't think you guys have been around for decades, right?
No, so our Los Feliz office is our first location, and we started treating patients in November of 2017. And we opened our second location in Highland Park, California, it would have been December 1, 2019.
Very good. So you guys are growing fast.
Yeah.
Now, can we talk a little bit about the NecksLevel device and maybe first your initial impressions and maybe the whole clinical impression, all the PTs that you guys have there. What did you guys think of it when my classmate Jake Moyer showed it to you all?
So we were excited to have Jake bring this into the office, and we actually did a small in-service for the entire team where we sent out the videos, and then Jake gave us a demonstration of how to use it, and then we quickly informed all the aides because we were all really excited to use it and tried it personally and started doing it with our patients one-on-one, and then quickly added it on as a flow sheet exercises and kind of brought all the aides up to speeds on how to use it for both the mobility and the strengthening setting. And we found a lot of immediate success and rewards with it with our patients. I think one challenging thing when you're teaching isolated range of motion or strengthening for the deep neck flexors, a lot of compensatory movement comes in or muscles kick in. And this was a great way to have the head, the neck supported, and the patient being able to more effortlessly find the correct movement for flexion, extension, rotation, side bend without, shoulder elevation or cervical extension and side bend. And they felt more control, I would say, and more safe in a certain capacity when doing it. Because I think a lot of fear comes in with moving into painful movements and learning new directions with the neck. And it was a way where people felt comfortable.
Good. How long did it feel like it took to get all the PTs and the aides up to speed so that it was, easy to implement in your setting?
I feel like with the PTs, once we watched the videos and Jake gave us that in-service, a lot of us were trying it even that day. With the aides, we emailed out all the instructional videos, and then during our 30 minutes with the patient and the aide coming over, because we're assigned our aides, they would come over and we'd be like, also give them kind of instructional of how to set up for the strength versus mobility. This is the head position, how to set it up. So a few sessions of those, now we could almost just check off NecksLevel, mobility, rotation, or NecksLevel strength yellow for rotation or flexion. And they're super independent with it, know exactly the setup we want. So it was really, really quick.
That's great to hear. Now, what have you been hearing from your patients specifically, or maybe, you know, the patients of the clinic after they've used it?
When I would say with the mobility, it feels looser, you know, that kind of stiffness after the repetitions of it going into rotation or side bend a lot. It feels, coupling that with some of our hands-on technique, following it then with the NecksLevel, it feels looser. They feel more range of motion, and the quality of the motion has improved because we're able to watch them from behind or from the side, giving that cueing, and they get that feedback of like, oh, I'm pressing into the platform the way I shouldn't be, or that cue, that proprioceptive feedback is better. So when they sit up and then move, it feels easier, less restrictive. And the strengthening component, I would say they're able to better isolate the muscles we want without kind of fighting as much into kicking into the pillow. Or using a side bend component, they're able to isolate the muscles, that deep neck flexor recruitment we want, with less compensatory strategies. So they're honing into the proper muscles we want activated quicker.
Here's a question that is so interesting to me. Why do you feel like physical therapists, like for you guys, for example, why do you feel like it was such an obvious answer for you guys? Like, what was available to you that was not appropriate or that wasn't ideal for prior neck exercises before you guys saw this?
I feel there's a dabbling between seeing PTs pull out the blood pressure cuff to do the deep neck flexor activation through that graded pressure. But I think, you know, setting up the Doppler, putting it behind the neck, you know, it's a little precarious at times and makes it hard to set up. And it still can be also hard to get patient feedback if they're actually doing it correctly and engaging, or are they using cervical extension instead of flexion to isolate it. So I think I would find the best ways, I would just kind of guide and hold the head, and like at first, like guiding that tilt, then guiding it. So it took much more time to get that precise isolated movement. Where now incorporating this, I feel like within a minute or two of going through the repetitions, the independence is a lot sooner.
That's great. And what are your favorite exercises that you like to prescribe on the device?
Outside of the ones covered in the videos, you know, I've actually started using it a lot when I am doing upper quarter nerve glides for median nerve. When I'm passively doing that, I'll set them up in side bend, and then they're doing cervical desensitization as I'm doing the passive. And that's really great, because I find that patients have a really hard understanding what side bend is. And when they're doing that with the nerve tension, they are causing more irritation. And that's been a great way to kind of passively complement. I really like doing it for deep neck flexor endurance in the different varying degrees of flexion and adding the resistance. So if they can't support their head off of the pillow, I can still ramp them up by going to the red or the green, doing reps like that, and really seeing if they're actually moving the platform and sustaining it. Like I can put my head there and be like, don't let that platform go, so that kind of tactile feedback is without them straining and using SEM or jutting their head forward if they were just supporting their own head. So building that deeper strength combination of endurance is really nice for that as well.
Very good. Now, most importantly of all, did you get to try it out when you had neck pain recently?
I have, you know, we took it home, both my husband and I had overlapping neck pain. And on Saturday morning, or I went in the office and worked on him. And then I took it home. I was like, no one's using this until Monday. So we both got on it, and I really liked having it for the rotation. There's just something so nice. It's like the trunk rotation. It's almost like doing cat-cow for your thoracic spine, just doing no resistance and just doing that isolated rotation. It just feels so rhythmic and relaxing that it just feels like that cat-cow for the neck, where you're just getting that kind of segmental movement without any stress or overload. And you're just kind of also feeling, oh, this is where I'm restricted and tight. Let me work through that. I think it just feels really comforting and relaxing.
Very good. And then would you recommend the NecksLevel device for other outpatient orthopedic clinics, like high volume clinics such as your guys?
I would. I think it is an easy tool. It doesn't take up room. We keep it in the Husky. It's labeled there. Everyone knows where it is. It's not bulky at all. It fits on the treatment table. A lot of us do it on the treatment table, or we move it to the floor with the exercises. So it's not one of those tools where you're like, where am I going to put those? Or is anyone going to know how to do it? Like, it is seamlessly worked into our plan of care.
Is there anything else that you feel like I haven't softball tossed to you that you'd like to mention about the NecksLevel device or using it in the clinic?
No, I just think it's been a really great addition. And I think it's just not like, don't only think of it for your neck patient. So a shoulder patient that's using overuse for their neck, a spine patient where you need to incorporate deep neck flexor for core activation. It doesn't just have to be for the cervical patient, like incorporating it. I've definitely used it for my shoulder patients and my low back patients. I did it with a hypermobile shoulder patient that would overuse their neck. I'd set him up. He'd have to sustain the deep neck flexion while we did IR/ER with the shoulder. So I think just it has multiple facets that can be incorporated for other injuries. It doesn't have to just be that cervical spine patient with neck pain.
I'm taking notes as we speak, Megan. These are great ideas. Thank you for sitting down with me and for the time. I know you're very busy.